Good morning, good afternoon, good evening, everyone. I'm delighted for so many of you to have joined us today for this session ensuring health impact towards tackling corruption. We'll wait a few minutes as we gather together in this virtual meeting space to give everyone the time to connect. All right, welcome again. I propose that we do start the session and people can join us along the session. So my name is Aurélie Pavisa. I'm working for the Health System Governance and Financing Department at WHO, and I will be introducing the session today. So we'll be using Zoom for today's session. Next slide, please. I'm sure everyone's become proficient in how to use Zoom by now, but I think it merits repeating a few simple instructions. Please look at the bottom of your screen for all the Zoom functions. During today's session, you will be muted by the host. Since you will be muted during the session, please use the chat function for comments, questions, and technical difficulties. Please click on the chat button to use this function. And at the end of the session, we will have time for a Q&A session. So please ask your question using the Q&A function. We also inform you that this session is recorded and will be made available on the Governance Collaborative YouTube channel. Next slide, please. We will also be using Slido for today's session. So you can go to slido.com. And once you arrive on the website, Slido will ask you for the code for this session. It is fraud and corruption in just one word. We will be sharing this password in the chat box, and we really look forward to engaging with you on Slido throughout the session. Next slide, please. So let's get into the meat of the session. I'll give you a bit of background. In 2019, we held a consultation with a multiplicity of stakeholders to discuss accountability, transparency, and anti-corruption in health. During this consultation, we all noted that weak accountability, low transparency, and corruption were undermining our goal. Next slide, please. In the health sector, corruption costs lives, it costs resources, it weakens health systems, and it exacerbates inequalities. So during the consultation, we also noted that work on anti-corruption in health has been largely fragmented and disparate, and that it has failed to reach its objective. So as a result, we decided to join our efforts to collectively address corruption. WHO, UNDP, the World Bank, and the Global Fund have teamed up to create CATCH. CATCH is the Coalition for Accountability, Transparency, and Anti-Corruption in Health. CATCH is a multi-stakeholder, multi-sectoral initiative with the primary objective to strategically prevent and address corruption in the health sector for the betterment of health outcomes. CATCH intends to induce real change and create an impact at country level. And we would like to do that by first creating and testing targeted, innovative, and evidence-based solutions that prioritize improving health outcomes, by bridging gaps and breaking silos that impede effective action in the health sector, by generating sustained momentum for ACTA in the health sector, and also by providing a multi-stakeholder platform to develop, implement, monitor, evaluate, and share ACTA approaches. Next slide, please. So 5 work streams have been identified for the work of CATCH. Those work streams have been identified in the 2019 consultation that I just mentioned before. And so we have 5 work streams. The first one is on health system strengthening, and it is to support countries to transform their health systems. The second one is on fraud and corruption risk management, and it is to improve efficiency of health systems and programs. The third one focuses on capacity building, and it is about developing capacity at all levels to tackle corruption in health. And the fourth one is about monitoring and evaluation. We aim here to provide evidence about corruption and solution to corruption. And the fifth one is about partnership and community of practice. So in our session today, we will particularly focus on the work done by the fraud and corruption risk management workstream. But enough said about CATCH, we want to learn more about you. Next slide, please. So please go to slido.com. As mentioned before, the code to access Slido for this event is fraud and corruption in just one word. And the question is, how would you categorize your organization? While you respond to Slido, I will hand over to Fatou Fall to moderate the session. Fatou is a compliance and risk management coordinator here at WHO HQ. And so Fatou, the floor is yours.
Thank you, Aurélie. Thank you, and welcome everyone to this session. While you are presenting yourselves, I'll very quickly introduce my role in this nice project of collaboration with the organization. So I'm working on in this risk work stream, heading the compliance and risk management activities in WHO. And I'm very happy to spend the rest of this hour with you and my dear colleagues, Annette and Bill, to go through some of the interesting ideas that were discussed in the consultation back in 2019. This is really a great opportunity, and I can see that we have in the audience people from project management and program management background, which is very helpful, because you will see that we will be talking about a lot about delivering programmatic objectives, delivering outputs. So welcome to everyone. So what happened in the consultation back in 2019? There was a general consensus that, well, corruption needed to be tackled primarily because it was affecting our health objectives, our targets to reach the Sustainable Development Goals set by the United Nations. And why? Because it had it affected those goals in so many different aspects. First, because it costed lives. There's a lot of researchers that can really map very easily the link between the corruption and the death rates in the United Nations member states. Also because corruption costs a lot of resources, specifically in the areas of procurement, for example. It also weakens systems because it really enables substandard and classified medical products to enter the markets. And very importantly, it also increases inequalities because it really inflates out-of-pocket expenses for households through facilitation payments. So really, this common acknowledgement helped us to really deep dive in very important questions during the session. And we are proposing today to focus on 3 questions. Are we focusing on the right corruption? And this is something that I will have the pleasure to discuss with Annette today. Which ACTA measures are actually effective? And when do ACTA measures excessively stall health delivery? This is really a unique opportunity to really look at the journey we took in the Alliance since 2019 and see whether the evidence that we are collecting is telling us different things that what the group was seeing. And I would like to start with Annette. Annette, could you maybe remind us, share what the group, the consultation meeting really acknowledge as being the way we are tackling corruption as part of the conventional anti-corruption and transparency measures. That would be nice to really focus on what was said first, before sharing your rich experience on the ground that you've had in the last couple of years. That maybe will help us maybe better understand that 3rd question of, when do we see ACTA measures, anti-corruption and transparency measures stalling health delivery? Could you share a bit your experience in that field as well?
Hello, everyone. My name is Annette Wierzyńska. I'm the Senior Specialist in Anti-Corruption and Impact at an organization called the Global Fund to Fight AIDS, Malaria, and Tuberculosis. The Global Fund gives grants to countries around the world to fight diseases. We're one of the donor organizations that have partnered with WHO, along with World Bank and UNDP in this coalition. lots of us as donors, and I just want to emphasize the learnings that I will be sharing don't necessarily always come just from the Global Fund. It's a common donor dynamic that we're observing. What was really interesting about the consultation that we had is that we were able to see that we're all basically experiencing the same phenomenon. The other thing I want to say before I just go into this approach is that the question of whether our anti-corruption measures are in fact serving health has become exceptionally important during the pandemic. And the question of whether, in fact, we are doing our job as anti-corruption specialists right is a question of lives saved right now. It's not just a matter of covering ourselves on reputational risk anymore, which is, I think, where we mostly reside. This is really about saving lives, and whether we target the right fraud and corruption schemes, the ones that are the most harmful to programmatic objectives, can make a difference right now in the pandemic. Similarly, if the way we manage our anti-corruption models actually stalls or gets in the way net of response to a pandemic, that also means that we're actually getting in the way of saving lives. So this is not a academic question at this point. This is a very serious, urgent matter. And I wanted to share with you a concept that I think many of you, I'm sure, are very familiar with, which is basically a risk-based approach to addressing any risk. In this case, it's fraud risk. What we've been talking about is that traditionally, fraud and corruption is managed through what we call a zero tolerance approach, which is basically all of it is bad, any of it is bad, because any corruption harms health. While that might be true, there actually is a level of scale around this that we're finding. And there are certain schemes, ways by which abuse of power is exerted that actually can undermine the delivery of quality interventions on the ground, gets in the way of actually measuring accurate data of numbers of lives saved, lives lost. I mean, we're all tracking the pandemic data right now. That accuracy of that data and whether there are interests in manipulating that data becomes extremely important because it generates decision making, where resources are allocated. And absorption is also an issue for making sure that the efficiency that the system actually can get money through it. So those are the kinds of schemes that we should be focusing on. And what we're suggesting as a group is that we should really ask ourselves, because we have limited time, limited resources, we have to ask ourselves, is the stuff we're going after, these fraud schemes that we're talking about and the corruption risks, is it yielding that kind of harm? Or are we talking about, sort of optimizing money, which is important, but not as important as lives saved, especially in an urgent pandemic? Or are we really bound by this sort of compliance-based approach of, well, we just need to make sure the documents are in place because if ever we get called out, at least we have documents to prove it. And what we've basically, when we put this slide forward before the consultation group, the vast majority of hands were raised when I asked where do you think your anti-corruption model tends to focus? Most of the hands were raised around the green zone and not the red zone. And the objective of this coalition is really to move up and strengthen the schemes that are in the red zone. And the way to do that is, unfortunately, I know we want it all, but we're going to have to reallocate resources and focus from the green zone to the red zone. Maybe I'll go forward. Fatou, is that clear enough?
Yes, thank you very much. That's really helpful to remind us where we started from. So now it would be great to share what you've been, encountering as, pieces of evidence here and there to support that global, recognition.
So we've been looking at actual investments on the ground over the last 3 years in our respective agencies, and what we found is basically a confirmation of what the consultations have flagged. I have a case study for you here. It's a very concrete example, which might give a little bit more meat to what we were just talking about in the theory. So we often deal with interventions around HIV, prevention and detection. And what we'll typically do in our interventions is we'll train a sex worker to actually identify other sex workers who need to be tested for HIV testing. And what we'll do is we'll tell this trainee, I'll pay you $3 for every new person you identify through an identifier code. This is critical because the disease is basically concentrated in hidden populations. So this intervention is quite important. What we found is that when we started looking at the fraud controls and the control system around that payment for that sex worker, we found that to pay one $3 payment, it took 15 forms and 7 people. That's how much we put in terms of controls. And as a result, the programmatic result was that these people were doing their job, but not getting paid for 6 months. I don't know how many on this call would do their job if the paycheck came in 6 months later. I think we would probably just go find another job, which is exactly what these ladies did. They went and found other jobs and left the whole programmatic agenda flailing. More importantly for this group, I'm sure what we found is that all those 15 forms that were being filled out actually were still hiding, and actually not even hiding. There were red flags of collusion and fake documents. And frankly, half of them were missing anyway, because it was so hard to generate 15 documents that we were actually generating more and more ineligibles. So we're neither addressing the fraud schemes, nor are we addressing the programmatic objectives. Now, this is a typical dynamic that I have observed literally no matter what country I've gone to, no matter what kind of implementer I'm working with, whether it's a UN implementer, a government implementer, or an international NGO. The bottom line is, as fiduciary experts, we tend to defer when we see a fraud risk to adding more documents and more checking, thinking that that means better control. And I think what we're learning through this process is that is not necessarily the case. Next slide, please. Here's another fantastic example of all the different levels of people who needs to get and give approval to even release a little bit of money in one of our countries. The interesting point here is there is no programmatic verification. There's no one here in this long list of people who sign off that actually checks if programmatically the request for the financing is appropriate. There's a lot of finance people, but more importantly, there's also a lot of senior people who interject themselves at the beginning and the end, which looks really robust, except guess what? That's who's calling the kickbacks. So again, more sign-offs, more reviews does not necessarily equal less fraud and corruption. Next slide, please. So what we've been doing is we've been looking at basically running these fraud risk assessments, not just in financial processes, which I think is where most fraud risk assessments reside, but actually across every step it takes from a dollar in to an activity out. And what we find is inevitably we're finding too many documents, and we're simplifying it, we're rationalizing it, of course, without giving up the important controls, fiduciary, financial, and programmatic controls that are necessary to achieve the objective. What we found, as you can see, is we were able to, by leaning down the documents, we were able to increase the efficiency. So the turnaround time for payment went from 16 weeks to 7 weeks. Then as a result, the peer educators started to stop dropping out, which is useful, which meant our programmatic targets were met, but actually, importantly enough, the documents just were not showing the ineligibles as anymore and the red flags. And we were able to start catching schemes, fraud schemes that actually occur outside of the document, but do actually hurt the programmatic results. Next slide, please. So fundamentally, what are we learning as donors? I think as donors, we're starting to see that we do a lot of our anti-corruption work and our control focus around processing requisitions, liquidation, and accounting and procurement, because that traditionally is where we think fraud is. And the way we do that is we typically focus on ensuring compliant and complete documents, because there's a working assumption in the world of basically accounting and internal control and audit that a compliant process as evidenced by compliant documents means the activity happened at value for money. What we're finding is basically in the field that is entirely not necessarily true. Through collusion and managerial override in work planning and design, and then through collusion in activity implementation, you could literally end up with a situation where you have perfectly compliant documents, but no activity happening with no value for money. And conversely, you could achieve lots of bad documents, but actually the activity is happening. So the bottom line is we need to really get more serious about how we design. We can't just default into typical design models. Next slide, please. So back to you, Fatou.
Thank you so much, Annette. This is really, really interesting, and stressing the importance of designing the right controls from the start is a critical lesson learned here. So let me turn to my colleague Bill, and on the second question, which is, are actor measures, as we commonly know them, actually effective when it comes to really input output based of ways of checking and monitoring the delivery of results. But just bear with me, Bill. Before doing so, I would like to hear from our audience on their experience in managing projects. Dear audience, I would like you to help us understand more, your ways of working and thinking as well. When you think of managing projects, where do you think efforts are usually put more into? Are we to prevent fraud and corruption? Are we usually looking at inputs only? Those documentations that really support the cost components of investments, or looking at outputs, inputs and outputs, or only outputs. This is just a way of measuring whether your experience is maybe reflecting or not what we are seeing and what we've learned from the consultation. So please continue to vote. This is an open polling session, so please feel free to vote while we are continuing. I see that there's a lot of experience in seeing input considerations, and that's what we will discuss now with Bill. Bill, can you give us a bit of insights when it comes to the drivers of cost of corruption and what we can learn from input versus output ways of monitoring the delivery of results? Over to you, Bill.
Thanks, Fatou, and thanks, Annette, for that fantastic example. I just say a little bit myself. My name is Bill Savadoff. I'm an economist. I'm currently principal health specialist at the Inter-American Development Bank. Started there 4 months before the pandemic, so you can imagine my work program has changed a bit from what I originally anticipated. But what I'm going to talk about here is, in response to these questions, is basically from almost 25 years of working on two what I thought were separate types of work: anti-corruption on the one hand and results payments on the other. But over time, these two things came together. And so what you're going to see here is I'm going to talk about how those two things come together in a way that complements what Annette was saying about the need to focus on the programmatic objectives. And I also want to say one of the great things about the ACTA meeting and this catch group is that it's interdisciplinary. So, and it's really critical for us to think about the language we're using, because all of us have our own disciplines and terms. I've learned to use the words programmatic objectives from Annette, whereas in my world of economic development work, we talk about outcomes and outputs, and we have a whole series of terms on that. And also just to throw out there that even the terms risks and costs are used differently by all our different fields. So I really encourage people, when you're talking to it's actually exciting. You sit down at a conference, if you're next to somebody who's not in your discipline, just ask them something like, what do costs mean in your field? And you'd be surprised, if you're as wonky as I am, how interesting the conversation might be. And in terms of answering the question, Fatou, I think this is sort of, I wanted to emphasize how there are different costs of corruption that we've sort of, you can distinguish. And one of the classic thing that people are concerned about is diverted funds, embezzled funds, kickbacks, money that's paid, bribes, these kinds of things. But what I'm calling failure costs is what Annette is calling program objectives that aren't met, programmatic objectives that aren't met. The failure costs are the sex worker program was failing to educate and identify people. In a bridge, it's, the bridge gets built, but it falls apart the next year because the bolts were substandard and so forth. There are other costs. I'm not going to go into detail, the direct costs, efficiency costs, there are dynamic costs of corruption, but I'm going to focus, if I can have the next slide, Fatou, just on those first two, diverted funds and failure costs, because I think these are the two biggest ones that we failed to meet, and it really addresses what Annette was saying. So if I could have the next slide. I'm going to contrast what I see as the way, again, from my language, it's controlling inputs instead of controlling outputs and outcomes. But from Annette's language, it was more about the document control process and looking at programmatic objectives. So I'm calling it controlling inputs. And this is the way a classic development project would run. There's a study and a plan and a contract to do inputs and activities. As the inputs and activities are completed, invoices and reports are generated. That leads to payments. And eventually, the inputs and outcome activities should turn into outcomes, the programmatic objectives. And then hopefully there's an evaluation which feeds back into better studies, planning, and contracting. Next slide. And what I want to point here is that the process of reporting and funding is all focused around the inputs and the activities. So there's very little attention to the outcomes or the evaluation. And in fact, often some of the disappointments about poor evaluation are that it comes late, it's not happening, it isn't given much attention. And given that it's not part of the process of the funding cycle and response to the reports and invoices, it's kind of understandable why management kind of forgets it and leaves it aside. And most of the procedures and papers and signatures that Annette was talking about are in this loop here with the invoices and reports. Next slide, please. So when it works well, the controlling inputs process does turn money into inputs as planned, and then the inputs turn into the outputs and outcomes. That's the nice story. When it doesn't work out, the money turns into fewer inputs at higher cost, the outcomes fail to materialize, the detection systems fail. And that's what we saw in Annette's example with the sex workers. So I want to contrast that with paying for outputs or outcomes. Sometimes it's results payments. I've got a paper in which I think I found about 17 different acronyms or abbreviations for payment for results, payment by results, results for whatever. But you get the basic idea. You're looking at what was trying to achieve, identify people and educate them, complete a bridge that would last for 20 years, distribute vaccines for COVID-19, and so on. And in this place, you can see it sort of shifted. So what the report comes when the outputs and outcomes are created, and the funding is dispersed against those outputs and outcomes, and then the implementer uses that money in that cycle to pay for more inputs and activities. Next slide. So in contrast with a previous one where all the attention was on the inputs and activities and the invoices, here we're getting a lot more on the reports of the outputs and outcomes. There's information, real information coming about the programmatic objectives and the money spent flowing against those. And it's the money flow that focuses people's attention very sharply on something. In this case, the output and outcome reports. Next, please. Again, to finish the comparison with the controlling inputs, paying for outputs or outcomes when it works well, the money gets paid in relation to those outcomes and the funds are handled legitimately. When it doesn't work well, it's that money has been paid despite a failure to get outcomes. In other words, there was a failure in the outcome reporting verification, Or, and this is another area where you may get the outcomes, but in some cases there might be legitimate methods to get there. Something that's coercive, that's human rights violations or environmentally destructive or something like that. Next slide. So this kind of summarizes what I see as the key advantage of moving toward paying for outputs or outcomes. And that just sort of, and that emphasized both the failures of the control system, or the documentation control system to get the objectives. Here, where I'm looking at is what risks are you taking when you try to control for outputs instead of controlling for inputs, or vice versa. And as you can see here, for the diverted funds and the failure costs that I was mentioning before, in diverted funds, when you control for inputs, there can be price skimming, they can deliver fewer inputs, the inputs might be poor quality. The failure costs, again, you might have fewer inputs, so you don't get the outputs you were hoping for, the inputs are bad, the planning is wrong, there's inefficiency. Making changes in those are all things that are very easy to hide, generally speaking. To find out that all the vaccines have been supplied, are good quality, and all this other stuff is very, very hard. Paying for outputs or outcomes, you can actually, you look at the things that are visible, not whether the technical review panel minutes show that it was held and that the procurement was done properly, but rather a sample of the things that were delivered to make sure the quality was good. And when you do that kind of a payment for an output or an outcome, most of the risks that you're taking are that the price that you set originally was too high, so there's some possibility of overpaying, or that the indicator error isn't really measuring the programmatic objectives you wanted. And my hypothesis or my challenge would be that we have a lot better ways to measure outputs and outcomes which are visible, and especially in things like health, the things that we care about, than it is to look inside the process of procurement or inside the process of the factory or inside all these different procedural things and reveal what's happening. And most of the formulas we use for paying are easier to manage, the indicators we're using are easier to learn about and manage in the output side than on the input side. Next slide. And here's where I'll sort of conclude the modalities, the two modalities in corruption. When controlling inputs, unfortunately, it has, I think, a dynamic of encouraging hiding corruption. That people want the money to flow, they want the invoices to look good, and so there's an incentive to actually hide corruption. Lots of information recounts. Rent seeking can thrive by reducing efficiency. And my main point overall is that honest agents face the same costs and sometimes higher than dishonest agents. When I see, when I'm reviewing a cost benefit analysis for a project and everything comes out perfectly, I start thinking maybe the information was manipulated, because doing a good study with real data is usually very messy. So there's always something that's a little bit off. The contrast being with outputs and outcomes, we actually measure what we care about. It can be fewer and simpler information requirements. When there's rent seeking, it can only occur if you've actually increased the efficiency with which you put in outputs. You need to skim the money off by working really hard. And the conclusion there that the honest agents are the ones that are facing lower costs than the dishonest ones. So I think that sort of sums up my sense of how it all works together. And the last point I'll make is that I'm not going to go through these, but the left-hand side here is what routine detection looks like in sort of a decision process. And typically it doesn't ask whether the results were achieved. It looks at the problem. Did we detect a problem? Was there evidence of fraud? If so, investigate. Was it isolated? If not, investigate, prosecute, reform. No mention of results. On the right-hand side is the monitoring outputs or outcomes approach. Even if you're not paying for the outputs or outcomes, if you're monitoring them and you're getting results, it's probably not a high priority place to look for corruption. If you're not getting the results, the next question is that an efficiency problem or is it a fraud problem? And that can link you into the normal investigative process. So this is a direction that I find I encourage people to think about whether it would work better for their systems than the existing modality. Thank you.
Thank you very much, Bill. This is really, really rich as insights, and this makes me, if I want to summarize the important points that we've heard today with your presentation, Annette, is that while tackling anti-corruption measures, it's really important to keep an eye on the objectives and design a fit-for-purpose fraud risk assessment that is not only looking at the financial issues, but really looking at ensuring that the programmatic objectives, call it outcome or output, are achieved. Another interesting thing that we heard today is that excessive attention to input documentation may cause both delay and affect the efficiency of the programs in scope. And it can give also a false sense of security, because all those documentation can, nowadays with the technology, can be very easily forgeable. So really paying attention to the output verification, outcome verification, results verification would be then a very interesting way to pursue, which also can come with some challenges. And maybe I will take this opportunity to turn to the audience and see what challenges they would see in really monitoring, limiting the monitoring on output results verification, or in paying for results. So really connecting the results directly, the payments, directly to the results. And specifically in the current settings of COVID-19, where we know that there's a lot of limitations in physical verification, in traveling and things like that. It would be very interesting to hear from our audience what type of challenges they are seeing, even sharing in the Q&As best practices that they have seen regarding innovative ways of monitoring results and outputs and outcome that we could also leverage in this reflection and also share back with our community. I'm just going to turn very quickly to Aurélie to see if there's anything coming from the Q&A, because I don't have access to that screen.
I want to encourage people to use the Q&A icon at the bottom if you can, instead of the chat if that's not working. Either way, put your comments or questions in chat or in the Q&A, but the Q&A seems to be the one that's working best.
We have a contribution here showing on the Slido. So Annette, Bill, please feel free to share any insights on that. So I can read PHC facility puts.
What I'm reading here is an example where a primary healthcare facility writes down that they've delivered certain health services, but they actually didn't, and they gave the vaccine or drugs to friends, so they're gaming the system. Yeah. I think this points out the importance of the way you verify information. So if the key what do I say? The key lesson for any kind of payment system is that you don't rely exclusively on the person who is billing you to tell you that they actually did what they said they were going to do. There has to be some kind of third-party verification, whether it's on the invoice side or on the input side or on the output side. And the example of the primary healthcare facility is a case where they've self-reported that they did something, but they actually, did something else. And there's just a range of ways to deal with that. I mean, I think one of the most interesting cases I've heard recently was in Central America, there are places where the vaccination coverage for children was considered to be quite good, 90%, 85, 90, 95% for children vaccines. And when you looked at the administrative records, it was quite high. But when they did seroprevalence studies, so it actually went in and tested kids' blood to see if they had the antigens there, the rates were like 50 or 60%. So this was not evidence of fraud and corruption necessarily, but it was a demonstration. There was a failure in the process of measuring the results. And so it unleashed a whole series of investigations. Part of it was discovering that the vaccines were not being handled properly. So even though they were administered, they had lost their potency. And in other cases, there were cases in which it looked like there probably was fraud and diversion. So I think it's a good example of where the way you verify these things is important. That's an example of sort of like a one-time check on the overall outcome. In a system where you're paying against something on a regular basis, then the typical thing is something more like a random audit of the performance of the project.
Thank you, Bill. Annette?
I see excellent comments coming in, and I just wanted to kind of build off of what Bill, you said. The comment that is on your slide, yes, it may work in very corrupt environment, may not work in very corrupt environments. Contracts are producing positive outcomes, may be awarded. I love this point because this is exactly where I started. I imagined that you can't pay for anything other than inputs, and you have to police all the controls, the financial, the procurement controls, because these people are not to be trusted and these systems have weak internal control systems. That's exactly where I started in my work. And what I found, actually, by applying fraud risk analysis to the highest corrupt environments, is that actually these guys are running circles around us. They can produce, all we're doing is teaching them how to produce much better fake documents, procurement and financial documents. However, I really want to actually point to another element of this comment, which is really, really important. Positive outcomes. I think there is what I'm learning through the process is it really, really depends which outcome you choose to link the payment to. Because it is true what you're saying here, whoever you are, that if you connect your money to an outcome, which basically can be produced anyway, then you can pretty much produce an outcome and walk away with the money. So what we found, and this is the point of the catch interdisciplinary dynamic here, is that you almost have to, as you're designing a programmatic payment model, meaning that you're paying against what Bill uses as the word outputs or outcomes, to determine which output or outcome to tie your money to, you actually have to run a fraud risk analysis and stress test each outcome that the programmatic folks, the health folks are suggesting. And basically go through the discipline. In other words, what am I doing? We're introducing what is basically fiduciary sets of questions in a systematic way to 3 main questions around output or outcome-based design. Okay, those 3 questions are: what should I be paying for? What price should I be paying? And how should I be checking it? And in each one of those 3 questions, you can ask the question, how would somebody come in and play that system? And that's basically a fraud risk analysis question. Then the next question to be asked, and this is really great because you were talking about giving the contracts to favored providers. I have a challenge back. If a favored provider can deliver a health service at quality within market price, it's still collusion. It is. But if you go back to that heat map we were showing earlier, what is the severity of that scheme ultimately? And I think this is where we as anti-corruption folks really struggle, because we think any kind of collusion or fraud or corruption is just bad. It's good or bad, binary. There's no scale. But when you're working in reality, when you have limited resources and you have to balance your controls against the efficiency of those controls, that is an actual really important question, because maybe, just maybe, it's actually more important to get the right price and the actual output and verify it in a way that they can't actually play the output, play the verification, defraud the verification. That might be much more important than making sure there's no preferred provider. Just to finish on this, my experience is this: if preferred providers and collusive partners know that they can't inflate the price and they'll anyway be held accountable for delivering the outcome, if they can't deliver it, they will remove themselves from the procurement, because they won't get paid until that outcome, that output is verified. So de facto, you're deterring that kind of collusion with poor performers. Over.
Thank you. This is really, we are full of passion when we are talking about all these issues, and that's why really the conversation continues. And as part of our coalition, Catch, we are really collecting different views and experiences on how to tackle this very complex issue of corruption in health. We are collecting, different ways of undertaking fraud risk assessment. And as we heard today, it's really important that we pay attention in designing the right controls. And just to share with the audience here, one way of doing that is really to make sure that we are able to really clarify roles and responsibilities, flow of funds, flow of information in a health delivery program. And we are, as part of the coalition, developing a tool to really help map those health delivery programs to facilitate fraud risk assessments, which are not only financial in their nature. So we are really calling the audience here to really spread the word and join us in our reflections. And if you really want to know more on our thinking and our initiatives, we invite you to keep in touch, and we'll, as part of the after webinar information, we'll share the different contact points that you can maybe leverage to keep the contact with us, because we are convinced of one thing, is that tackling corruption in health, it's really a sectoral wide issue, and which cannot be tackled in a silo. It cannot be tackled by funders, donors only, or implementers only, or recipients only. It's a really whole of a sector approach, and this is why we are here, and looking forward to continuing this conversation. I'm now going to hand over to our colleague Aurélie to close the session, and thank you again for the great conversation. Thank you. Back to you, Aurélie.
Thank you everyone for participating to this great session. So as mentioned, this session was recorded and will be made available soon on the Governance Collaborative website, and we'll send it to you by email as well, with the few information that we just mentioned. Thank you very much for the conversation, and we look forward to future webinars and future occasions to engage with you all. Thank you everyone.